Some calling the distribution of a COVID vaccine the biggest health operation in history, in LA history. Question is, can they pull it off?
It's going to be a major undertaking.
The backbone of the distribution system early on will be hospitals and pharmacies.
Dr. Richard Seidman from LA Care says many hospitals and pharmacies are already in touch with the state to register as COVID-19 vaccine providers. They'll also have to meet the criteria needed to take on the task, including how to store the vaccine properly.
I'm sure people have heard about challenges of properly storing the Pfizer vaccine, which requires ultra cold storage at minus 70 degrees centigrade before it's thawed and eventually brought down to room temperature for injection into patients.
Dr. Seidman says they're anticipating tens of millions of doses to be made available before the end of the year. Chris Sedens, KNX1070 News Radio. 1224 on KNX, LA County's public health director says they'll be ready for vaccine distribution when the time comes, but for right now, some county supervisors aren't quite so sure.
About 10 million people, give or take, live in Los Angeles County, 66,000 homeless. Distribution of a COVID vaccine will be an enormous undertaking. The public health director is expressing confidence that they will be ready for the job, but county supervisors need more convincing. According to the LA Times, one raised concern that the preliminary plans are too vague. Another wants information on the issue of equity. We talked to the head of LA Care Health Plan about that issue of vaccine equity. Dr. Richard Seidman says he believes it is being addressed because it's so important, it has to be.
The death rates in the poorest communities in Los Angeles are double what they are county-wide.
LA County has already reportedly acquired 16 ultra-cold storage freezers for installation across the area to store that Pfizer vaccine when it comes out. So far, it's not clear how much vaccine California or LA County will get. Vicki Moore, KNX 1070 News Radio.
The scientists have developed the vaccines. Now comes the hard part, figuring out how to quickly and fairly distribute the life-saving medication.
Many California hospitals and pharmacies are already in touch with state regulators, registering as COVID-19 vaccine providers. Part of the process includes meeting some very strict requirements, not the least of which is knowing how to properly store the vaccine.
We're anticipating tens of millions of doses to be available before the end of the calendar year.
Dr. Richard Seidman is with LA Care.
There's a deliberate effort being made to assure that low-income communities of color are high on the priority list to get the vaccine into those people who frankly are dying at significantly higher rates.
Some are calling the distribution of these multiple COVID-19 vaccines the biggest health operation in LA history. We'll soon find out if the bureaucracy can pull it off. Chris Sedens, KNX 1070 News Radio.